I grew up in Storm Lake, Iowa. It's a small farming community, rural community in northwest Iowa. Growing up, like a hematologist would call it a just low platelets, just thrombocytopenia, and they would just throw up their hands and say it's not a big deal, and off you go. In high school, there was about a couple months where my platelets were low enough where they wouldn't let me play basketball. Easy bruising, as well as allergies, horrible allergies, and kind of chronic sinusitis. And other than that, it was just I just always knew it as kind of a fact of life that I had just lower platelets, and I just needed to be careful. And when I found out about RUNX1 was when my father was diagnosed with leukemia, and then I followed up with his hematologist and was just went through the full a full bone marrow biopsy and was diagnosed with RUNX1 FPD as well.
Early on, I remember seeing pictures of myself with many, many bruises on my legs from playing during the summers and everything outside. My primary doctor always was worried about my blood, specifically my platelets, and they were down around 50,000. So he sent me to the hematologist, and they did a blood draw, and this guy walked in, and he said, you know, your platelets are 50,000. Why did he send you here? Well, because he's concerned about my low platelets. I don't know. He's my doctor and I trust him. But he just completely blew it off. And yet my doctor never gave up, and finally he's got me to the right place. Completely surprised me when I was diagnosed with leukemia 3 years ago, because I was feeling great, living life. Life has changed completely since then. I've been wearing a mask long before the nation was. 3 years now almost. I imagine I'll wear a mask off and on the rest of my life, and that's what my transplant team wants me to do. Your mortality comes up in your mind a lot more than it did before you had leukemia. No doubt about that. You just kind of live every day a little. You're grateful for every day, for one thing. That's a little simple, but that's kind of the way it is with me.
Emmy's story is very much entwined in the whole thing. Emmy was born at 30 weeks, so she was very premature. And so from a very early age, she had lots of illnesses, lots of respiratory stuff, lots of gastro issues. We heard a lot, like, she was premature. It's fine. Like it's probably related to that. It's nothing extra. She was about 1.5, I think, when I finally decided to seek help from a gastro and like start looking into some of the issues. Like there has to be something you can do to help her, right? So she saw a lot of different doctors. They were pretty aggressive with testing because, again, she was a preemie and it could have been something to do with that, but everything was coming back negative. She had all these issues and there was no reason for any of these issues. So it really started for her right after her second birthday. She got an ear infection and she was covered in petechiae. So when I took her to the doctor, like, yeah, you have an ear infection, but I'm like, yeah, but what about all this? Like, what's that from? That's not normal. We've never seen anything like that before. And that was when she had her first CBC. And so once she had that, it came back that she had low, but not super low platelets. So they basically told us, it's fine. You would expect them to go a little bit lower when she had the ear infection. It's probably nothing. Her regular PCP was not happy with that answer. We'd seen like a weekend person, ear infection, whoever you can get into. But her regular PCP said they're not concerningly low, but they're also not low enough to be causing what we're seeing here. This is still not normal. So she was actually the one who connected us with a hematologist. So we took the on-call hematologist and really, after all the specialists we'd seen at this point with nothing, I assumed nothing was going to come of it, that we were just going to hear oh no, it's going to be fine. At least you saw someone and got a green light again. But she was amazing. And right when we started seeing her, Emmy was 2 and a little bit. And that was when Steve was diagnosed with CMML. So before the runks came out, it was just the leukemia diagnosis at that point. And I think something in her mind clicked when we did the history, because she started down a route of testing that we could not get approved. Our insurance kept taking the next gen panel and scratching it like, you don't have an active cancer diagnosis. We're not spending the money for something like that. So she tried to back in. So we did platelet aggregation testing. And of course, just like most runks patients, she failed, has an aspirin-like defect. You could tell she was trying to get somewhere with it. But it was right about that point when Steve was found the runks deletion. So they actually have a deletion, and that kind of gave her the, yay, we could do something if we wanted to, because clearly Andy had a lot of the same history, and she assumed that he would have it as well.
My hematologist at Rochester would want to know what records I have of my family, doctors' records. And I was able to find some for my mother. There was certainly evidence that she had a blood disorder too.
I was diagnosed 2 years, a little bit over 2 years ago. I've never been super negative about the diagnosis. It's always just, there's nothing I can do about it. It doesn't help me to ruminate on it and think about it and worry about it. But it has added an added level of definitely planning more and being more mindful about, how I treat my body and how I deal with stress. Whether it's eat better, whether it's adopt various methodologies to decrease stress and inflammation. From the research, decreasing inflammation is a big way to lower your risk of cancer. So that's kind of where my head's been and how it's changed my life.
I'm in the NIH study, and I'm fascinated by this. I might as well learn as much about all of this as we can with RUNX1.
The natural history study is huge. It's like from all those specialists that I'd seen, every time, I don't know how many different doctors I've asked, like, how is this connected? How, like, it's impossible for her to have all these siloed conditions that in no way go together. And over, I would hear, no, none of these go together. These are all separate. You need to continue to see the separate doctors. Like, it's all different. It's not different. Once we figured out it was the runks, they are all connected, and it just really opens your eyes to what's out there and how you can be better served, which the foundation has done an amazing job of.
It's not a death sentence. They've had so many advancements in treatments for the leukemias and everything. When I was diagnosed almost 3 years ago, my doctor said, 7 years ago there was no cure for CMML, which is my specific diagnosis, and now there is. And keep the faith and be strong in your faith, and rely on your loved ones and friends, because that's what I did.